Chronic Fatigue Syndrome, Mental Effects You Need to Know About, by www.adrenalfatiguesymptomsandtreatment.com, www.adrenalfatiguesymptomsandtreatment.com. If you are suffering from chronic fatigue syndrome, it is important for you to know that this condition has symptoms that can overlap the symptoms associated with severe psychiatric or psychological disorders. It has been found that depressed patients are seen to experience substantial fatigue, and for some patients, this is basically the most distressing part of their illness. The role psychiatric disorder associated with chronic fatigue syndrome, or CFS, is not really clear. This is mainly because people who are affected psychologically can also be suffering due to physical illness rather than a psychiatric disorder. You have to consider that it doesn't show the relationship of higher rates of psychiatric disorders found in people suffering from chronic fatigue syndrome compared to other chronic illnesses. Psychological problems related to chronic fatigue syndrome is still controversial, as people suffering from chronic fatigue syndrome are also diagnosed with depression as well as other psychological disorders. However, most people with chronic fatigue syndrome do not experience any psychological disorders before they get chronic fatigue syndrome. According to health experts, people get depressed because they are suffering from the symptoms of chronic fatigue syndrome. In fact, there is a recent study that shows people suffering from depression was basically the result of an illness, and it does not entirely cause the illness. There is a very close relationship between psychological disorders and chronic fatigue syndrome. This is because people who are suffering from psychological disorders experiences symptoms that are also associated with chronic fatigue syndrome. These are such as loss of interest in food, difficulty in concentrating, difficulty in sleeping, and even feeling extremely tired, as well as experiencing frequent headaches. Some professionals conclude that this is mainly because of chemical imbalances in the brain and is mainly caused by adrenal fatigue. The symptoms will eventually make people depressed because they see other people who are able to function normally in society, which they find difficult to do. Diagnosing chronic fatigue syndrome is quite difficult in the early stages because of the fact that it cannot be identified, which may upset the patient because no one will believe that he or she is ill. This will make relationships difficult at home or even at work or school. It is highly recommended that you should immediately consult a doctor or a psychologist in order for you to determine whether you are suffering from psychological disorders or chronic fatigue syndrome. Through proper diagnosis, you will be able to know how to intervene with your illness, which will eventually treat depression as well as chronic fatigue syndrome. You can never rule out the fact that chronic fatigue syndrome can also cause depression and other psychological disorders. Experiencing chronic fatigue syndrome will make you feel extremely tired or exhausted, which will prevent you from performing normal daily tasks, which will eventually get you depressed. There are basically a lot of self-care remedies for treating chronic fatigue syndrome. One good example is to rest and manage your stress levels. This may seem impossible to do in the busy lives we live in today's society. But you do have to try to find a way for you to rest your body in order to keep it energized and prevent feeling extremely exhausted physically and mentally. Remember these tips and you can be sure that you will be able to effectively treat chronic fatigue syndrome and also prevent depression. Visit www.adrenalfatiguesymptomsandtreatment.com now for more.